Well, good morning, everyone.
Good morning.
Welcome to the scene. My name is Elizabeth Harness, and I will be your moderator for this particular discussion, which is called Better Access, Brighter Futures. We're going to be talking about increasing access to early eye exams and prioritizing eye health in preventative health care. We have a fantastic panel with us this morning, all of them very dedicated to this topic as both providers and industry leaders. So I'm going to introduce them very quickly, and then we're going to go into our discussion. So thank you all for being here today. To my right, I have John Lakey. He is the Global Head of Marketing from Hilco Vision. Then we have Jane Balick, who is Executive Director of the Vision Council's Vision Health Alliance. Next to her, we have Joseph Carbone, who is a board-certified optician, as well as President and founder of Eye Care for Kids. We also then, next to Joseph, have Dr. Millicent Knight, who is the Senior Vice President in Customer Development Group of Essilor of America. Thank you for being with us, Dr. Knight. And rounding out our panel today is Dr. Spencer Quinton, who is President of the Nevada Optometric Association. He is also past president of the Southern Nevada Optometric Society. So thank you all for making the time out of your busy schedules to be with us today. We've had a lot going on over the last 48 hours under the umbrella of the topic that we're going to speak about today. And Jane, I wanted to start with you as part of the Vision Health Alliance. Over these 48 hours at Vision Expo West, we've been doing some pretty special things, both here on the floor as well as within the Las Vegas community. And I was wondering if you could talk a little bit about what we've been doing over these 48 hours as it relates especially to the new consumer campaign, Let's Be Clear, that has been launched. And let us know a little bit more about the initiative.
Thank you, Elizabeth. I want to thank all of you for being here and our great partners at Vision Health Alliance. So we are the consumer awareness program of the Vision Council, and we are really just on a mission to make sure that people understand that eye care is critical and that comprehensive eye exams are an important part of preventive health. And so here at Vision Expo, we really wanted to sort of make a statement about how important it is by creating resources for local Clark County schools with our partner at Hilco Vision. And so we created these emergency care kits for school nurses and school partners to have those resources available for children who are having problems at school. But at the same time, we also partnered with our great friends at Eye Care for Kids to make sure that children had screenings and comprehensive eye exams. So it was a great way to talk about the importance of eye care and comprehensive eye exams, but also to do something to give back to the community.
Fantastic. It's been fantastic work, actually, and a lot of fun, actually, for those of us who have been participating with them today. You know, we talk about this idea. I mean, we see it in marketing. We see it even on greeting cards. You know, the eyes are the window, right, to so many things. They're the window to your soul, the window to your body. But this is actually, in terms of eye care, so important and so true. They are a window into the ability to spot many different kinds of diseases in the body, sometimes early issues with the eye, but also systemic diseases that are occurring in the body. Tell me a little bit about, and I can go to you, Millicent, if you'd like first. We'll start with that. Just a little bit about how a comprehensive eye exam what it can potentially tell us in terms of our overall eye health.
Thank you for that question. A comprehensive eye examination is so important, and eye care providers are such an integral part of the healthcare system because you can detect not only eye diseases and provide some early diagnosis and in some cases even prevention, but the eyes are the window into the whole system. So if the body is inflamed, the eyes are inflamed. If the eyes have inflammatory issues going on, like diabetic eye disease, you can bet the same thing is happening throughout the body. The American Optometric Association actually says that there are over 267 diseases that can be detected through the eyes. So it's a great opportunity to not only take care of your eyes, but to take care of your body as well.
Mm-hmm. What do you think, Dr. Quinton, some of the biggest barriers are, or actually not even barriers, what are the reasons that many people say, I'm not going to worry about my eye health right now. It's not as much of a priority. I need to get my blood pressure checked before I need to worry about my eye health.
Right. A lot of people will, if it's not broken, they're not going to fix it. They often don't understand that many of the things in the eyes that can start to show up as problems will not cause a change of vision right away. It often takes years, and many things that can be identified early can really make a difference. So I think a lot of the, everyone gets busy, everyone has developed certain routines, but often if eye care has not become one of their routines, sometimes it's not in the top of mind. I have patients all the time who didn't start wearing glasses till they needed reading glasses in their 40s, and they're wondering about their children and surprised that when I tell them that their children should be seen, the first year of life and checked for things. And we have people we find things all the time like that. So I think a lot of it's getting used to the idea, the importance. When you don't have the problem, you don't realize it often.
Let's put a little bit of a spotlight on, and yes, absolutely, continue.
There are a number of optometrists, and myself included, who took blood pressures on every single patient that walked through the door. And that's also a really good way to not only be able to assess their blood pressure, give them that additional value add to the exam, but you can also look inside of the eye, and you can look at the blood vessels, and you can see signs of high blood pressure, cholesterol, diabetes. All of those conditions are readily available, and it's a great opportunity to educate the patients because we use retinal photography, Doc, right? And we use different diagnostic tools by which we can actually show the patient their own eye. There's nothing like showing a patient their own eye, and if there's an issue there, then they want to address it. And I unfortunately can't tell you the number of patients that I've actually had to send to the emergency room because they were pending strokes occurring in the office. And their chief complaint was blurry vision, and that's what they thought they were presenting for, to get new glasses. So it's a great opportunity for us to really be able to help these patients.
Fantastic.
One of the things I really love about what you said about that comprehensive eye exam is yesterday when we were at the school in the Eye Care for Kids van, the children were getting really great comprehensive eye exams. And just for them to have that experience was really wonderful. And I saw a little girl walk out of the van, and she had her dark glasses on because she had just had a dilated eye exam. I think for me, getting kids in there early to see that it's not a scary experience. It's painless. When a couple years ago we did a relationship with the Daily Bumps, and they had their kids in for an eye exam, and I remember the little boy said, "You mean I don't have to get a shot?" So I think the more we make the children comfortable, and Joseph, maybe you can talk about what you do to make the kids comfortable in your with Eye Care for Kids and your clinics.
Absolutely, and really quickly, I want to add to that point, Jane, Joseph. I'd love you to give us a little bit of an idea about what we were doing yesterday at the mobile clinic, because Roundy Elementary School, where we were, is one of dozens that Eye Care for Kids services in Nevada, as well as provide these kinds of services in other states across the country. So a little color on that would be very helpful to what the need is in this community.
Thank you. And the need is greater than we could ever imagine. So as we were just speaking, globally, there's over 500 million children that don't have access. There are several million in our own backyard in America who do not have access to professional eye care, to the wonderful professional comprehensive eye exams that we were just talking about. So Eye Care for Kids, in partnership with other organizations and professional organizations, we hire optometrists, eye doctors, board certified, state licensed, to work in the areas to help us provide comprehensive vision care, a comprehensive eye exam, new cool eyeglasses, and the kids love it. So on our mobile clinics and in our brick and mortar clinics, the child is able to pick out any frame they love, which is something they don't have an opportunity to do at home. They're given hand-me-downs. So obviously we're talking about disadvantaged kids, and that is who we try to help. We help in New Jersey, Utah, Nevada, Arizona, and this is what we do.
You made a comment yesterday at the press event that we had at the elementary school, which I thought was quite interesting and something that if you could elaborate on a little bit more. You said that many of the families that benefit from these mobile clinics sometimes think of eyeglasses as a luxury. And you were giving some specific examples of how glasses are kind of used in these different families. And I'd love you to kind of give that
Sure.
to experience.
And that is a great point. So many families see it as a luxury. They're trying to decide, do we pay for rent? Do we buy food? Do we dress our kids? and 40 years ago, my wife and I started out that way.
Mm-hmm.
So not only was I the kid growing up for Italian immigrant parents, but we started life out that way also with our family. Our first child we saw here in Nevada. We had the eye doctors here, and this is however many years ago, 10 years ago or so. The mother came out of the exam room with her child, and she says, "Who's in charge here? Who did this?" And we talked, and she says, "They told me at school my child was slow." And what we're finding out today is all he needed was a pair of glasses. That mother couldn't afford the glasses, but at least she had the answer. And we see this wherever we go. In our New Jersey clinic, to what you spoke about, we had the doctor come out of the exam room with tears in his eyes. And he said, "This wonderful child here in Newark, New Jersey, we just found out that he has advanced glaucoma." And they came in for blurry vision. And the doc had tears in his eyes, and he said, if we didn't see this today, diagnose it, and treat it, there's a very good chance that within several months, he could be blind in that eye. So we're grateful for the support we receive in the partnerships to be able to do what we do. It's very rewarding.
Elizabeth, that's great, such a great point to distinguish the difference between a screening, a well-intentioned school screening, a pediatrician screening. It's great, should be done, but it should not take the place of a comprehensive eye exam that's going to look inside, check the health of the eyes, check the eye pressure. It's going to really check how the eyes are working together. Not just can they read a chart, but can they function together. I had a patient, I've had many of these, but one in particular, the mother came in, he keeps bumping into the wall, and this young man had about four diopters of astigmatism, quite a bit of astigmatism. And she had no idea. Her and her husband don't wear glasses, the grandparents don't wear glasses, there was no family history. Now, of course, family history, especially now with nearsightedness, we know family history, that's a risk factor now. We want kids to be seen annually, but a lot of people, like you talked about before, a lot of people just don't know the importance of getting their kids' eyes checked, because the kids don't know. They assume, whatever's normal is normal. I think many of us remember putting those glasses on for the first time and seeing clearly and being just amazed. And so often kids just don't know what they're missing. And so the importance of a full eye exam.
The goal should be every child, every year, an annual eye exam.
I agree.
So to draw down on that point with Dr. Knight, actually, I wanted to, and I know you've got something you want to add to this point, and I've got a question for you as well. So I don't mean to double load you there but what age should children start receiving eye exams, and what does a comprehensive early age eye exam look like for a child?
Okay, so let me just first say that unfortunately, a lot of parents don't know what to look for when to assess whether or not their child has a vision issue. And it's often seen in ways where the child is squinting, or sometimes in school the child is a behavioral problem. And in fact, the child is moving away from what's going on because they can't see it. And so one of the first things we want to do is educate parents. And then in terms of regular eye examinations, they really should start as early as possible. There's a program called Infancy that I know I participated in with, you participated in, where through the American Optometric Association, where a child is able to have an eye examination between 0 and 12 months of age at no charge to the parents. It's a volunteer project. And it's really valuable to get that good foundation in place. And then my next ask ordinarily in practice would be that all children, it's a travesty in this country that we do not examine our children before they start school. So by the time they're 5 or they start preschool, these children should have an eye examination because it's foundational to their success, not just in school, but in life. So that's one of the things that I think we really as a country need to work harder and more aggressively on, state by state, whatever it takes to get that done.
And I think, Elizabeth, you hear a couple of key words here. It's about education, awareness, and partnership. And I think that's why we have, our partnership with Hilco Vision has been so important. Not only has Essilor supported our previous initiative, Think About Your Eyes, but without the partnership of the vision community and the vision industry, we can't get the word out. And so Hilco Vision has, they don't do eye exams, right? But they provide a lot of, it's like we don't make this, but we make it better, right? Hilco provides a lot of the things sort of behind the scenes that doctors use to help, to help eye doctors and help that ophthalmic community do their job. So maybe, John, you could talk a little bit about why Hilco's been involved in what Hilco Vision and why it's important to you as a company.
Well, just to start, I think all the points have been great, but I think there's another word here, that advocacy is really one of the things that we need to have in the industry, because like with prenatal care or anything else early in life, parents really don't know, and teachers don't know, and they need to be educated, and programs like what you're running out in the field spread the word, so to speak, in addition to some of that screening we've seen and support out there as well. Hilco does provide a lot of things that go on behind the scenes, and that's great, but it's really about the overall industry partnering together to drive forward on these initiatives, because as you were articulating, when I was a little kid, I was in the front row every year for 3 years, and I was the best student in the class. No, seriously, I was. And then another kid joined from out of town, and I got pushed to the back row. Within a matter of weeks, my grades changed dramatically, right? And they went the wrong direction. And I think that my teacher recognized that. I got an eye exam, fortunate to do so, right back to where I was before. But the point of the matter is that is something children experience across the board, and they can't be their own advocates, but we can be as an industry partner. And that's what's great about Hilco, Essilor, and other companies coming together to do that work.
It's so true, and when we just launched Let's Be Clear, we had done a bunch of consumer research around the people who said they had never gotten an eye exam or rarely get them, and what we found was they just didn't know. 95% of people said they really valued their vision and their sight. 30% knew that getting an eye exam was a way to protect that. Compare that to the people who said their teeth were important to them. 70% of those people went to the dentist every year. So I think that that's the piece that you've talked about it, we have to do more, and what we found is people are confused. I think the pandemic, we've thrown so much information at people, they really just don't know how to decipher it, and so that's why we call it Let's Be Clear. We're just telling you honestly, you need a comprehensive eye exam. That's the way you protect your eye health. And it also could lead to the detection and the ability to manage other chronic conditions. And I will say, I was on my way over here and I bumped into one of the people who work in the exhibit hall, and she was telling me that she has glaucoma and diabetes, and she dislikes her eye doctor, so has not gone. And all I said was, she said to me, "Are you an eye doctor?" I'm like, no, I'm not. But I said, you must see a doctor. You must. I mean, you could lose your vision. There's things about your eye health that you need to take care of. And she said, I just had a terrible experience. So what do we do for those folks, right? How do we stop that? Because that person is in real danger of losing her vision and other health consequences, right?
Well, I think if you want, I can start it and pass it on. The problem with diseases like glaucoma is they don't hurt. Mm-hmm. And so people, just it's not physically bothering them, often they might be neglectful. But unfortunately, it is one of those diseases that if left unmanaged, you will lose your vision. And so just education is so important. And that's one of the things that I think we could do a better job as, in addition to the advocacy work that you mentioned, which I absolutely agree with it. But one of the things that we can do a better job with is educating our patients. Every step of the exam, that patient should know exactly what you're looking at and exactly why you're looking at it. And that patient should never leave the office without being pre-appointed, so that they know that they need to come in for a regular exam. Eye care professionals should invest in technology, innovation, so that we can diagnose things as early as possible and track them and manage them and keep them under control. And we should make sure that we're reaching out to our healthcare provider partners out there and making sure that we have relationships with them so that optometry is seen as an integral part of the healthcare system. And that's something that, again, we all need to do a better job of. One quick question, comment about the advocacy piece. EssilorLuxottica is passionate about partnering with organizations that get the word out to the consumers about the importance of early eye examinations and regular eye examinations. And we've been involved with the Global Myopia Awareness Coalition, GMAC. And one of the surveys that we recently completed, many parents are concerned about the increasing use of digital devices with their children, the gaming, the e-schooling, all of these things that their children are doing, and they're paying attention right now to that. Yet, only 25% of those parents said that they'd actually made an examination, a visit to their doctor or an appointment to see their eye doctor. Conversely, they've gone to see their dentist, and they believe, 72% of those parents believe that when they take their child in to see the pediatrician, that the child received a comprehensive eye examination. So we have some work to do.
Absolutely, great points. And you can give her my card. My office is about 15 minutes from here. But it is, it's so great what the Vision Council is doing. This awareness has been done in other industries, and we've made great efforts over the years. I think we need, as an industry, to continue to be consistent with our messaging and not never get tired of the message, because you always have new people coming up that have not heard the message. So I think just not tiring of, and I think we're all passionate about it, and so it's one of those things we'll continue. But I think also having that consistent messaging and maybe educating other, pediatricians, other industries. Ophthalmology doesn't sometimes have some of the same guidelines on, some of their societies. So it'd be good to have consistent messaging, and then on a one-on-one level, I think most of medical decision making, it's obviously those one-on-one relationships where, as we have patients and staff and advocacy groups and industry, that we all talk to those we come in contact with in the shows, on the plane, in the restaurants. As we talk to people, that message just spreads.
I want to ask one quick question on this discussion, because there is always this idea, and it doesn't matter what your economic level is. I've known through my own experience in working in industry, there is this one prevalent comment that seems to come from people. I just can't afford eye care right now. I can't think about that. I can't afford that. They can go to their dentist, to your point. They can go to their primary care physician. I just can't afford eye care. What do you say to that? And how do we reverse this thought process, the stigma, if you will, that people have about it?
What I say to people when they challenge me on that is, I said, just like with every other service or product, there is something for everyone in the eye care industry. I mean, you can find affordable eye care, and that shouldn't be a barrier. There is confusion about that, right? There's confusion about vision plans and how much it costs. And one of the things we have on our website is just call and ask, how much is an eye exam? I mean, it isn't that difficult, but I think people have this perception because they seem to be, I don't know, I don't want to say outraged, but just surprised that, their spectacles or their lenses may cost a lot. And But they're the same people I talk to who get their hair colored and highlighted every other month for hundreds of dollars. And so what I say to people is, your eyes are something you have to have every day to do what you do. So how do you put a price on that? Let's take the day by day cost of what an eye exam and glasses cost. It's minuscule. I don't buy it. I am such a great advocate. I'm not an optometrist. I consider myself to be just a professional advocate. And I just think there's so many, every time someone has a challenge to me, and on the annual comprehensive eye exam, people will say, but, where are the guidelines for that? The ophthalmology has different guidelines. And I say, here's what I want you to do. Go to your eye doctor. And then you build a relationship and decide. You too can decide what you need to do based on your needs. And I think people don't think about, they haven't gotten used to the preventive care aspect of eye care. And that's really what we need. We need to be educating them. It's part of what you do. You go to the dentist, you go get your physical every year. For women, we get mammograms every year. Just get an eye exam.
Jane, I'm with you. People will pay for what they find value in. It's just that. And Joseph, I was just going to say, the work that you do with Eye Care for Kids is amazing, and we need more people doing work like that. EssilorLuxottica is passionate about supporting organizations. As a matter of fact, I think we've contributed to $400,000 a year toward your cause, and I think going back to 2015, we've been able to contribute about $1.7 million. It's a great cause, and between our own Essilor Vision Foundation and the over 1 million eye glasses that we've given to children to make sure that everyone sees well and is successful in their lives. And then we have our One Sight program as well. So there are a lot of ways that children and adults can access care. And we know that the last 18 months or so have been really challenging for us with COVID, and a lot of parents are out of work. And so we've got programs like the Changing Life Through Lenses program, which is a program where if an optometrist or an ophthalmologist or anyone who's eye care professional has a patient that needs eye care but can't afford it, and the doctor is willing to do the eye examination at no charge, we do not believe that the doctor should also incur the cost of providing the lenses and frame, and we will pay for those and provide those at no charge to the patient or the doctor.
So we're
That's
grateful
really amazing.
for the partnerships, the collaboration, and what we're hoping for. So it's cost and it's accessibility. And so one of the things we're trying to build a greater panel with is to have doctors in their own offices, if they could, do the professional eye examination and then refer them to Eye Care for Kids. We'll give them the glasses for free if the cost is an issue. So we love Essilor Vision Foundation, we love Hilco Vision, we love all of the manufacturers and larger corporations who are leaning in and donating and making this possible, because we couldn't do it ourselves.
And I think, Dr. Quinton, you can probably speak to this. I know working with the Nevada Optometric Association, every doctor I meet has a passion for what they do. And I think I'm sure it's hurtful to hear, it's too expensive because it's such a value. I think that the coordination of the care and the information and the education is really just so essential. And as you said, it's all coming together with that one message. And that's really what we're trying to do at Vision Health Alliance. We're really trying to connect people to resources, to bring the industry together, to talk about how important it is, but not to confuse. We just have one message, right? It's eye care and eye exams. That's it. We want to leave the rest to you.
Yeah,
People you can talk about what an eye exam is, the products, the lenses, like all of the things that the industry does to make our lives better. We just want people to pay attention.
I think that's right, and I think to Elizabeth's point, bringing up cost, you really can't afford not to take care of your eyes, and there are so many options, and so great to see just on the industry side, on optometrists. We had Dr. Jones out there yesterday at Round Elementary School. our doctors are always happy to, donate time, and also, like you said, often in our offices that can be more efficient. And so I do see a lot of such great things with Eye Care for Kids, with Lions Club, different groups that are doing so much. And as I think of even my staff, you talk about being a professional advocate. My staff, they're some of the strongest advocates. They spend most of their days answering the phone and answering phone calls and helping people. If we don't take their plan, hey, you can go over here, they take your plan, or and finding resources, finding either community or industry resources or their insurance, figuring out this maze of things and just making sure they get the help that they need. And just it's we have really an army of effort going on, and it's really quite amazing.
You touched, Dr. Knight, on the pandemic, and as did you, Dr. Quentin, as well, just a little bit. And I want to go a little bit more into that because we don't know, honestly, how much longer we're going to be continue to be affected by the pandemic. It's going to continue to evolve and that sort of thing. I'm curious, what are some of the things you are noticing in your practices, in your businesses, because of the pandemic, that in terms of the need? Has the need increased? Do we need to do things a little differently now to continue to make sure that eye health is still a priority and that people don't just throw it by the wayside?
I think the first thing that we had to do was get the consumer, the patients, comfortable and feeling safe to go back into the doctor's office. And I think that the practitioners have done a great job of really making their practices a safe and welcoming environment. And they've also learned to use technology to gain as much information about the patients in advance so that the patient is minimizing the amount of time that they're physically in the space. And it's a much more effective way of practicing. And I think that using technology again allows for the doctors to really spend that concentrated time, almost like a concierge type experience with the patients, and to really be able to address their needs and to direct them to the right products and services that they need to be comfortable.
Absolutely. I think that's excellent. And in addition to that, on the other side, we are seeing definitely, I'm sure obviously due to pandemic conditions and remote learning and remote working, so many patients with headaches, eye strain, all the computer vision syndrome symptoms we've seen for years, just intensified and in all age groups. And so the importance of that has become even more apparent. And if there's one silver lining there, would be that parents are more concerned about their children's eyes. They realize that can't be good for the kids. My son he's in there rubbing his eyes. His eyes are watering. I mean, we're seeing just some severe symptoms, and so I think it's brought it all to the forefront for sure.
There's another pandemic that we should be talking about, and I'm calling it a pandemic because it's a global issue, and that's myopia and the increasing prevalence of that. And it's just, it's mind-boggling. I mean, we know now that and predict that if we don't do something proactively about myopia now, by 2050, half of the world's population will be myopic. And a billion of those individuals will have high myopia, which again puts them at risk for myopic macular degeneration, cataracts, glaucoma, and retinal detachments, all of which are certainly vision-threatening and in many cases could be life-threatening. So these are some of the areas that we have to really work together across the industry to really be able to address this in a much more effective way.
Why is it that myopia is, we talk about it, I think, in spurts, if you will, but we don't put it often into all of the literature and all of the comprehensive discussions around this, and I'm always curious as to why that is, why we don't have more of a spotlight on that.
How it's actually talked about,
Or the awareness of it.
Yeah, I think because we're really at a point now where we're understanding that there's more to myopia than correcting it, but there's a way of being able to manage it now, and there's a lot of new technologies out there and that's only going to increase. There are going to be more tools in the toolbox for doctors to be able to address it effectively and to really be able to keep and manage those patients from increasingly progressing in myopia. the children now are now starting to develop much more myopia much earlier, and the earlier that they develop it without it being managed, they run the higher risk of those high myopic issues that we just talked about. And so I think, again, that's something that the industry is pulling together to bring more tools, but the doctors also have to learn those new ways of managing it. And we also have to reach out to all of the stakeholders that see those children. You know, the teachers, the nurses, the pediatricians, the PAs, everyone that has access to that child also needs to know that these are vehicles, that there are new ways of being able to manage that. And let's not rule out any stakeholders. One of the biggest issues I had once with a child or early learning experiences early in my career was a child that we were treating for actually a strabismus issue that had to wear a patch. And she wasn't getting any better. We couldn't figure out why, and the child said she was wearing the patch. But the bus driver happened to overhear the conversation between the parent and the teacher, and the bus driver said, "Oh, she wears the patch every day. She just switches it to the other eye after you leave." So, I mean, we can't discount anybody. Everyone can help out in this process.
That is
full
such a
circle of
great
care.
point. Yesterday when we were at the school, Dr. Casa from Clark County School District was, Joseph said, "What more can we do?" And she said, "Education. It's the teachers, it's the social workers, it's not just the school nurses. It's everybody who touches that child. It could be the lunch lady or the bus driver, right?" So I think that's where, it's sort of a light bulb that went off to me as the Vision Health Alliance. This is a great role for us to fill, right? Is doing that outreach, talking to the pediatricians community on a national kind of association level, getting in there and talking to those folks. Our survey also told us that patients said, if my primary care doctor told me to get an eye exam every year, I would. Okay, well, let's start there. Let's start talking about the value of what an optometrist, what an eye doctor does, how that contributes to overall healthcare. I just think there's a whole other lack of awareness. It's not just parents and teachers. It's another area that we can sort of uniquely fill to sort of take that on and start building those let's get a whiteboard. Let's identify all the stakeholders and let's start working on that.
I want to actually ask a little bit about that because this is funny. I was going to ask these questions and go into the education point of it and the parents and the caregivers, but what we're really talking about here is also an awareness of how large the circle of care really is around a single child, and it's taking into consideration every person that touches that child's life in a given day, from the time that they wake up to the time that they go to bed. And everyone in that circle has an ability to spot something and exchanging that. What should caregivers be looking for in children specific to a potential eye-related issue? Because I've often heard, too, when I've done this in industry, that parents just say, well, I just don't really know what to look for. Because children, as Joseph, you said, too, are not going to speak up for themselves. They don't know necessarily that they have an issue.
I'll start, and I'm sure you'll think of more, but the obvious of the squinting and having to get closer to things, rubbing their eyes, headaches, eye strain, walking into walls, being clumsy, of course, eye turns, all these kinds of things, but also reading below, grade level, having trouble in school, having behavioral problems. All of these things can be manifestations of visual conditions.
It was my teacher when I was in second grade who sent a note home to my parents saying, "I think your child has vision problems." I sat at the front of the class too,
There you go.
but primarily because I found out later because I couldn't see, and it was determined that not only did I need a visual correction, but I also needed vision therapy. And I have vision therapy for probably 6 months. And my father said that one day he picked me up from vision therapy, and I very matter-of-factly said, "Dad, I'm going to be an eye doctor." And he said, "Oh, that's great." But, he had a little bubble. He was like, "You're 8." But, I was so impressed, I guess, with the overall experience and having people who really seemed to be invested in my well-being. I didn't know what they did, but I knew that I wanted to do that for other people. And that's where it starts, and just giving people an opportunity to see. And that's one of the things I love about the Vision Council, too, is that you all really work hard to make sure that there's programs are available, that there's culturally sensitive eye care available. That's something that's really important now. And I think you asked about what's different about an eye examination, and I'm sorry I didn't answer that earlier. But I think that the critical thing is you not only have to check the acuity, but you also need to check how well the eyes work together, how well they team together, and ask some questions, because children need to go outdoors. They spend so much time at a focal point that's not just 16 inches to standard reading distance, but they're now holding their devices at 12 inches, 13 inches, which is a really difficult accommodative strain for the eyes. And we believe that what works best, particularly as it relates to myopia, is for that child to get outdoors, get into the sunshine, get some vitamin D for at least 2 hours every day. And it just makes a big difference. And in addition, they should be shutting their digital devices down at least an hour before bedtime. Now, we adults need to lead by example, and I'm failing.
I think all of us might be. Yeah.
The reason that you want to do that, too, is because the natural hormone melatonin needs to kick in to allow the brain to shut down so that the child gets a nice, peaceful rest so they wake up ready to go in the morning. And when that doesn't happen, they're groggy, they have the headaches, they have eye strain, and it is just not a good, productive day for them. So,
One of the things that I'm hearing is that, you're talking about education, you're talking about awareness. Doctors are busy. They're so busy. And I think one of the things I love about our alliance is that we leverage the partnerships to actually get to doctors in many ways, right? Hilco Vision has a network of doctors that they work with. They provide resources, education resources that they can pass on, doing as much for our doctors as we can that makes things turnkey for them, so that you can just say, here's a resource, right? You don't always have to do all of that, because we want to help you be that awareness piece, so that you don't have to, okay, I'm out here, kind of beating this drum, you need to do this, you need to do this. But through providing resources, we can actually help maybe fill that gap a little bit and pass that on. And really, not only do we have things available for consumers, but we've started to creating resources that our American and Optometric Association affiliated organization partners can use. We make them available to doctors, we make them available to partners, that all has that same messaging. It's just like plug and play, right? I think that I am always aware of how much we try to put on the ECPs to get the word out, to try to do all this. It's impossible. I don't know how you care for patients and to also do that. But I also know that many of our industry partners are doing that. They're trying to help the ECP. They're trying to provide those resources. And the more, I think that's really one of the important roles that industry plays, is getting those resources, making those resources available to the doctors. I don't know if you're able, what's missing, Dr. Quinton, that we could do more?
I think it is always great when a patient comes in having already been made aware of something, and they can already ask and say, hey, I'm noticing this, and we can focus right in and be more efficient. I love seeing, some of the different, some of the industry, they'll have, brochures on eye safety. They're concerned about sports vision injuries, things like that. And you'll see the, some of the brochures I know from ESLOR we have from on blue light and on myopia control, different things. So I think the information's excellent. There's a wealth of information on websites and things. So I think, and I think what the Vision Council is doing is going to be great as far as just continuing to this let's be clear campaign. Just I think that's the public awareness where we get in and meet them where they are, where people are. They're online, and so if we have good, if you have good social media things, that's where people are going to see that. I don't know the percentage of people now get their news from social media, right?
Yes, and they do, absolutely. Go ahead.
Well, I was just going to add to that. I think one of the things, Jane, that your organization is doing so well is trying to bring everyone together. But we need the positive stories that have been told on this stage of improvement as much as we need the negative stories of what can happen. Because a lot of what parents try and model is positive behavior, right? And I think as a parent, I can leave my blue light devices on as long as I want because my kids are still small. No, just kidding. They go to bed before me. No, just kidding. But the point of the matter is, right, your children need to model that behavior, as you were saying, and parents need to see those positive examples to model other parents' behavior or reach out if they are in a situation where they can't afford it to organizations like yours to just drive forward and find a way to get the correction that they need for their child. Because really, when you think about it, there's the giant loss side of the equation here, which is the fact that you fall behind in reading and your lifetime outcomes are greatly affected. But the positive side is you end up with an optometrist on the stage, right? Because you go forward with the right correction and are inspired. And that's a really great story about where it can go if the intervention is what it needs to be at the point in time. I did have a question, since we're talking about blue light for the group. What role do you think device industry has to play in this? I mean, they're probably a little bit down on our list of who we need to get in touch with, but more and more of our lives are governed by our digital devices on our wrist and in our pocket. And I'm just kind of curious what everyone thought about that.
Okay, I think I'll take that. Well, for me, I think we have to work a lot more in partnerships and collaborations with partners outside of the industry.
Yeah.
There's a great opportunity, and that's a great point, because that's we have a partnership now with Facebook, for instance, that we're going to be bringing to the marketplace. But there's a lot of industries out there that we can partner with, so that when they're launching products, they're launching them in a responsible way, in a way that has an understanding behind it for eye safety and any of that type of support that we can provide. I think one of the other challenges right now in the industry is there's everyone's scrabbling for good employees and staff. And not only are the doctors working so hard, but they don't have the staff and support. And that is one of the reasons why, as industry, we work hard to bring training tools and materials. EssilorLuxottica has a training program, a learning management system to help those new employees get onboarded, because you don't have time as a practitioner to onboard and teach new staff members. And so this takes one more thing off the plate. So again, your focus can be on taking care of that patient.
To bring awareness, one of the things that Eye Care for Kids is doing is the Glasses On campaign. And we started with several celebrities, and it's just, I got my glasses on, get your glasses on. It's really important to wear glasses. And kids say the darndest things. And we got a letter just the other day. We for 17 years, we take our mobile clinic in Utah to the Four Corners area, to the Navajo reservation. And we got back from the reservation, got them the glasses, and we got a little letter back. And this little boy said, "I love my glasses. I can even see an ant." And how cool is that? That the child is becoming aware. As Dr. Oz says, he gave me a pair of glasses that he bejeweled with insects on it. He says, "I love insects," and that's what I wanted to become a physician. And so if kids can get engaged with seeing properly, I think half the battle's over.
That's awesome.
I think one of the most surprising things that I've found in terms of the awareness on all issues is that it spans every socioeconomic group and education category. I have, friends that are very well educated, and they are still surprised when they see some of our awareness pieces on social media. My own daughter, we had an Instagram post about gestational diabetes, how an eye exam could detect that. She was horrified. But also really, she said, I had no idea. I had absolutely no idea. She lives in my house. She hears me talk about this all the time. And I think so when we design the campaigns, we've been trying to be thoughtful about the messages for different age demographics, because I think that I don't care how educated you are, there just seems to be such a lack of knowledge about the importance of eye exams, and I think that's really an area we need to do much better. And I'm sure you see it in your practice, right? I think it probably, people just don't know. They've gone without, or they just think they know better, or they're not having a vision problem, and they got their health under control.
Every day, yeah, every day, patients that are surprised that we can see some bleeding in the back of their eye from their high blood pressure or diabetes, and surprised that, we're sending them over to get a carotid artery, evaluation, because one eye is showing a lot of change and the other eye isn't. So there's probably something here, or, visual field showing, there's something you need to see a neurologist for this week, things like, they're often surprised.
But if you took an assessment of the one sense that people would be least interested in losing, it would be vision. Always. It's how we experience the world. But yet, as an industry, we've allowed this to become commoditized to the point where there's no value in differentiating products and quality and going in for regular eye examinations and everything that entails, all the opportunities that provides. And so it's really critical to me that as an industry, we work together, we hold hands, and we lift this up and give vision the stature it deserves.
These are all such important points, and I want to pull in one piece when we were talking about all of the different kinds of educational pieces. We've talked about myopia, and you mentioned also sports. And I want to draw down on that because while it might seem like a minor piece, it's actually a really important one because, and I'm not just referencing, high-end sports and such. I'm talking about just community playing, around kids playing, ball on the court and that kind of thing. The injuries that can happen, the protectiveness. Also, this is not only a place where you can perhaps spot whether a child has a vision issue, but it's also a great place for prevention of something that can be life-altering as well. Could we talk about that a little bit?
Yeah, I have many monocular patients, one-eyed patients due to eye injuries over the years of different ages. And it can be any type of sport, anything that flies or moves quickly can hit the eye. And so wearing protective eyewear is always, should be always front and center. We should always be talking about that. It's one of those things that, often doesn't get talked about, but it's very important. Whatever the sport, there's protective eyewear for it, and you don't see. Obviously, you see some big names wearing them, and I think that helps kids. It does have an effect, but it needs to be done more. We need more awareness of it.
We have a partnership actually through Luxottica with the NFL in driving that message of the importance of making sure that there's the proper safety protection. We have standards in this industry, the ANSI standards, to make sure that children are wearing the proper lens material so that it's most impact resistant for them. But the other thing that we have to be aware of and watching more closely for is the concussive issues. My son wants to play football. We're not aligned with that because of the concussions and just how serious they are. And there are devices on the marketplace to allow for easy assessment of that. I think there's a product called the King Divic test, which was actually developed by 2 optometrists many years ago that can be used for early detection or any other neurological conditions. But that's, again, one of the other many ways that going in for a comprehensive eye examination, we have the tools available to be able to detect all of these different things.
And I think that's it. When I sit here as a layperson listening to all the different things, it's why I think we just need to stay on that very top line message of eye care is important. Get a comprehensive eye exam. Leave it to the experts to identify and provide all that education, because we couldn't possibly in any awareness campaign address everything as comprehensively as it needs to. But what we want to happen is for everyone, parents, adults, caregivers, to have a conversation with their eye care professional, with their optometrist, about what's important for them. And that ranges from what your needs are for your vision correction if you need to, for your overall health, for your sports protection for your child, for myopia, for vision therapy. I mean, we've touched on so many things. We couldn't possibly cover that on a website. That's why, for us, it's just that top message. Eye care is important. Get a comprehensive eye exam. That's it. Your eye doctor can do the rest.
We have about 5 minutes left in this discussion. And first of all, I just want to thank all of you again. This has just been a very rich discussion with a lot of different topics covered. But I wanted to ask this question of each of you. So whoever's brave enough to go first, that gives the rest of you the time, actually, to think about your answer. But I think, we're all up here as representatives of industry, we're providers. And I'd like to know from each of you what your thoughts are in terms of what is, in your opinion, one or two things from where you sit in the industry that we can do more of to help further prioritize eye care as part of our overall healthcare planning? And I'll give you a little time to think about that as well.
I'll jump in. Parents. Educating parents. There's through social media, there's so many parental influencers out there now that are really driving messages. And to your point earlier about social media, it's where a lot of people get their information. The opportunity that we have is to educate those parents, and to really, my dream would be to drive some peer pressure. What? Your child hasn't gone through myopia management yet? It's kind of like, like with retainers or taking care of your, that kind of message gets out there. So that would be the really critical thing. It all centers around education and awareness, because when people know better, they do better.
I love that. That was exactly what I was going to say. But no,
now you have to come up with something else. No, I'm just kidding.
I think from a provider's perspective, in addition to just doing your job and doing it well, being involved in your community so that you can be an influence for good beyond just your patient base.
We can't do everything, but we can do something. And that is the important thing, whether it's education, bringing awareness, or providing a product or a service. Everyone has the responsibility to do something for someone else.
And just to build on that, it's really up to your ability and up to your need, right? From an industry perspective, if everyone chips in and joins the Health Alliance and contributes, that takes us one step closer to getting more information in the hands of parents, to giving providers the opportunity to do their job and make the vision correction that they can to influence children's lives. So I really think that we're on the right path here. Your organization is leading the way, but you need a lot more vans out there, right, to reach all those kids. And that only happens if we all come together. And I also wanted to make sure Jane went last.
I think I love this industry. I have seen so much generosity and compassion and really just love for what we do. I've never, I've had the good fortune to work in a bunch of industries, and I find that people that you talk to are just really dedicated to eye health. I think for me, I think we've got to get beyond our own community. We have to, Vision Health Alliance, we have to start networking out into, the broader medical community, into the stakeholder community, as Dr. Knight mentioned before. That's what we need to do, because we cannot do it alone. We can't do everything, but we definitely can't do it alone. We need those partners outside of our community, outside of the optical industry, to start saying, yeah, that is important, and you should be doing that. And I think that's where we can add value.
Very good. Well, we're just got about a minute left, so I just want to thank everyone again for their time. And I think that this has been a very rich discussion. And for those of people who are just joining us here in the room or just tuning in, this was a discussion on better access, brighter futures, increasing access to early eye exams, and prioritizing eye health in preventative health care. I want to take one more time to just introduce the panel to close with. So I want to thank Dr. Spencer Quentin, who is president of the Nevada Optometric Association, Dr. Millicent Knight, who is senior vice president and customer development of group at Essilor of America. I'd like to thank Joseph Carbone, who is the founder and president of Eye Care for Kids, Jane Balick, executive director of the Vision Council's Vision Health Alliance, and John Lakey, global head of marketing for Hilco Vision. Thank you very much for your time today, and we hope that this has been a great discussion for everyone.
Thank you. Thank you all.
Everyone.